We're ready for systemic change. And I think the American people are too. I am Dr. Olivia Richman. I'm a family medicine physician and also a doctor influencer, aka Docfluencer. I actually started doing social media back in medical school when I saw a lot of unwanted teen pregnancies and sexual assault cases. I brought this idea up of starting a YouTube channel around sexual health to my attendings who were like maybe in their 60s and they were men, and they were like, do not do that. You will ruin your career if you talk about sex online. And I was like, I'm going to take the chance. And it did not ruin my career. And so that's when I first started getting into social media. Recently moved into Docfluencer MDO last year. I saw how many Docfluencers had influence on social media and how many millions of followers they had. I wanted to create a unified place for everyone to come together as a collective because that didn't exist. I wanted to bring us all together because we're stronger together. I wanted to create and amplify these credible physician voices to shape culture and policy and patient care. In the middle of the summer, we were like, okay, let's do our first campaign. We wanted to highlight the harm of insurer red tape and prior auth delays. It reached over 2 million people collectively, and over 100 Docfluencers from across the country participated in that campaign. It was very moving and also heartbreaking at the same time, hearing everyone's stories. More stories in the news started coming out about vaccines. All of us were unified in the decision that we wanted to make this campaign about vaccines. We wanted to show how in our specialties and in our experience and in our training, how vaccines can help our patients. It got picked up by Senator Elizabeth Warren's team. I think that that's one of the main goals, since this is an advocacy group, is that we do want to get more connected with politicians. Policy is where we can make a difference. I have amazing visions for a conference, for lobbying presence, and then also maybe even some Docfluencers running for office. Who knows? We want to put Docfluencers at the center of advocacy and reform. The healthier we keep people, the less long-term chronic diseases they could have, right? Some things are going to be inevitable, but a lot of conditions are preventable. As physicians, we see a lot of sickness and we see a lot of suffering with patients. I had a full day of patients today, just seeing a lot that could have been prevented. We know that if we're able to just give one piece of information that could help multiple patients or 100 or 1,000 patients from that suffering, suffering themselves, suffering around with their families, we do it for free. And a lot of us are doing it for free. We don't know the bigger direction of where this is going, but I think that just being on purpose and sticking to an overarching goal is going to make a positive impact somehow, some way.